Hi, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And this is part 3 of a 3-part series on training the female client, especially activating the pelvic floor and integrating its function into core, shoulder, and hip training. Many of your clients struggle with pelvic floor function, and that leads to chronic hip tightness, low back pain, as well as incontinence. So in this 3-part series, Janice and Sara have been sharing with you the strategies we use with our own clients in our clinic, Chicago Integrative Movement Specialists, to help give you the tools, strategy, and more important, the process to working with clients that have pelvic floor issues related to their pelvic floor and how they're breathing. So in part 1, Janice and Sara discussed the importance of surgery, or the impact, I should say, of surgery, trauma, and pregnancy on the female core. And many of these women struggle regaining optimal core function after surgery, trauma, and or pregnancy. In part 2, they discussed why doing Kegels is not always appropriate unless they've been specifically prescribed or recommended by an OB-GYN specializing in the pelvic floor and or a pelvic floor therapist. Today, I'm going to have Sara come in and discuss exactly how to coordinate function of the diaphragm and pelvic floor into some functional movement patterns. So that way you can see how this function integrates and how we train it in our clients. I'll have Sara jump in next and discuss and demonstrate how to coordinate breathing and pelvic floor activation.
Hi, I'm Sara Fisher, co-author of What Lies Beneath and also Integrative Movement Specialist. I'm going to take you through a few patterns, whether they're low level, body weight, or even loaded patterns. And the key concept is that we coordinate the diaphragm and the pelvic floor no matter what the load. So your diaphragm and pelvic floor should lower and lift in coordination with that breathing. No matter the load, there should be a degree of motion. We should not have a constant squeeze and a hold of that pelvic floor. It needs to be able to move.
As the individual breathes in, the diaphragm and pelvic floor should both move down towards the feet. As the individual breathes out, the diaphragm and pelvic floor move up together towards the head. The client will lie on her back, place her fingers inside her AS-ISs. As she breathes in, she'll visualize the diaphragm and pelvic floor moving down towards her feet as her abdomen expands into her fingers. As she breathes out, she'll visualize the diaphragm and pelvic floor gently moving up towards her head, and her fingers will sink into her pelvis. She'll breathe in through her nose and out through her nose, maintaining a steady breathing rhythm. The diaphragm and pelvic floor should move together both during inspiration as well as expiration. Perform 3 to 5 breaths per cycle and then rest.
For the happy baby position, it's going to be a little bit more of a braced position, but we still don't want to see any distension through the abdomen or drawing in, squeezing of the glutes, crunching of the neck. We still want to see that same relative position and maintaining the breath. So I'm going to start with that long spine, still the breathing into the ribs. I'm going to float one leg up, float the second leg up. My length should not change, my abdomen shouldn't change, and I'm going to stay for 3 breaths. So there will be, like I said, a little more bracing, but I should still be able to coordinate that diaphragm pelvic floor motion with my breath. After my 3rd breath, I'm just going to float one leg down, followed by the second leg, and again, the position really shouldn't change. All right, we're going to look at the quadruped with a little bit of a hover position. So we're still going to start with that nice long spine, coordinating the breathing. We still want to coordinate that diaphragm and pelvic floor. So I'm going to make sure once I land my hands, I'm going to stay nice and long. I'm going to start my exhale to sit my hips back, keeping my length, and then float the hips up and stay here for 3 breaths. So I want to stay nice and long. As you can see, I can still talk through this. And I should still have that coordination of the lifting and lowering of the diaphragm. And after my 3rd breath, I'm going to maintain my cues to come back down. All right, I'm going to take you through a supported squat. So you're going to face the wall or chair or Smith machine in front of you. You're going to start with that nice long spine. Think about that nice breath, fanning those ribs, and then you're going to lightly hang on. Okay, we don't want to grip. As you exhale, you're going to sit those hips down and back, and then start your inhale to come back up. Remember, we're coordinating that diaphragm and pelvic floor motion as we go through the squat pattern with that momentary pause. Start the inhale to then lengthen back up. Pause. Start the exhale. Pause at the bottom of the squat. Start the inhale to come back up. That way we're coordinating that diaphragmatic and breathing and pelvic floor motion. We're going to go through a body weight squat. So we're going to continue to coordinate that diaphragm and pelvic floor with the breathing into our squat. So you're going to start with that long spine, taking your breath, picturing those ribs just fanning, and then hands on the hips. We're going to go exhale, let the sits bones go back, pause at the bottom of that squat, start that inhale to lengthen back up. Pause. Start the exhale. Pause. Start the inhale. Lengthen back up. So remember, I am exhaling just a little bit longer than I actually inhale to help me keep that alignment of my TPC. All right, going into the loaded squat, we're actually going to change up the breathing pattern. So I'm going to exhale on the up motion and inhale on the sitting back into the squat. And I still want to make sure that I'm maintaining that lowering and lifting of the diaphragm and pelvic floor, but I'm not exhaling and squeezing at the top of that squat or just in order to come up. We still want that relative piston-like motion, but it will just be a little bit less than it was for the body weight squat or even the lower level patterns. All right, for loading up that squat, remember I'm going to inhale as I lower and exhale as I come up. But I'm still going to maintain my length, my ribs spanning. I'm going to hold the dumbbell right by my chest so I can stay long without compressing. I'm going to take that nice inhale to lower, pause, exhale to come back up. Pause, inhale as I lower, and then pause, exhale as I come back up. So I'm still not squeezing on my way up, so I'm not squeezing my hips forward. I'm maintaining my length and my breathing, and yet I'm still coordinating my diaphragm and my pelvic floor. For the deadlift pattern, we still want to coordinate that diaphragm and pelvic floor, so I'm going to start with my length and my breathing, and I'm going to inhale as I then lower. My arms are just nice and relaxed. And then I'm going to pause, and I'm going to start my exhale to come back up. You can see I'm still maintaining my length. Pause. Start my exhale and come back up. I'm still not squeezing at the top, and I'm maintaining nice and long. That way I can still coordinate my diaphragm and pelvic floor.
I hope you enjoyed this video and it helped demonstrate how to integrate the function of the diaphragm and pelvic floor. In recap, they should move together, and during inspiration they descend, and during expiration they rise, so that way you can regulate internal pressure and coordinate their function with all the core muscles. Janice and Sarah have created a special 2-day course to help you become a specialist in working with your female clients, especially after surgery, trauma, and or pregnancy, to regain function, more optimal and efficient function of the core, as well as integrate breathing, the diaphragm and pelvic floor function into core, hip, and shoulder exercises. And the important part of this 2-day course is they will discuss information that's so relevant to so many of your female clients, because so many of your female clients have had surgery, trauma, and or multiple pregnancies that have impacted their core function and how they use their diaphragm, deep abdominal wall, as well as pelvic floor. And they will also share with you the most appropriate and best way to assess your clients, because if you're not assessing, you are guessing. You are guessing what your client needs, so you want to make sure you have a very accurate and consistent assessment process. They'll share with you exactly how to do that, and then how to take the information from your assessments and determine the most appropriate corrective exercises. And we gave you a little taste of that today in today's video, as well as the video we shared last time. Breathing is the number one thing we do with our female clients, and that's a first place to start. However, you must also understand how to safely and effectively progress your clients so they're doing the right exercises and in the right manner. So they'll take you through the progressions, the most effective progressions to get your client to where she wants to be. So that way you help your clients feel better, move better, and perform at her best. So click on the link either above and or below this video, learn more about the course and to enroll. We've got a couple special bonuses that come along with the course, and we look forward to seeing you. It's a very small course. There's no more than 12 people in this course, so that way you get lots of hands-on attention. So you leave understanding how to assess, how to use the most effective corrective exercises, and then how to integrate this information into your functional programs. So we look forward to seeing you at the event. Take care, and we'll see you soon at Integrative Movement Insider. Take care.